Hi there, this is Tom Parmalee, the founder of funeralvision.com. And today I'm joined by Dr. Amy Schiffman, who will be one of our speakers at Funeral IQ, which I'm co-hosting with Sympathy Brands, the parent company of Cemetery.com, eCondolence, and Shiva.com. Funeral IQ will be September 20th at the Live Casino and Hotel in Philadelphia, Pennsylvania. We are so thrilled that Dr. Schiffman will be one of our speakers. Thanks for joining me here today, Dr. Schiffman.
Thanks for having me.
First, you are not a funeral director, and I think it's so great that we're getting some other voices on our program at Funeral IQ. Tell us a little bit about yourself.
Sure. I am an emergency physician by training, and in the world of medicine, you can get certifications for lots of different things. And while I was an emergency physician, I wanted to break off and do house call medicine, and it fit right in to become a hospice medical director. So I got certified as a hospice medical director, and of course, it's very adjacent to the industry of funerals and cemeteries. And so what I did was, as I became a hospice medical director, I became very closely tied with the local funeral homes and places that I was acting as a hospice medical director, which included the DC metro area. And that's sort of how I kind of got to understand this industry a little bit.
Oh, great. Now the title of the presentation you'll be delivering at Funeral IQ is titled Bridging Hospice and End of Life. What are some of the topics that you're going to be focusing on during your presentation? And I guess more importantly, why are they important for funeral professionals to think about?
Absolutely. So one of the things that I noticed early on when I was a hospice medical director is that lots of patients, that included people with every possible diagnosis that were coming into hospice, because of course that is by Medicare standards, the last 6 months of life, had everything from dementia to cancer to congestive heart failure to diseases related to their lungs. And many people had had long-standing illnesses. These were not illnesses that sort of came upon, and then sort of required them to seek end-of-life care. But people have had a long-standing history of these diseases, and then they were just sort of qualifying under the Medicare guidelines. And I was sort of shocked to find out that many people had not chosen a funeral home at the time that they came into hospice. And even more shocked to understand that there was a real resilience to having that discussion, even whilst in hospice, so that people had not chosen sort of what was going to happen at the final time that they died. And that became a stressor for families. It was a stressor for the patients themselves if they were able to speak for themselves. And it sort of it interested me that this was a challenge even in people who are reaching end of life. I became also interested in some of the nomenclature, and as anybody knows, every industry has their own way of speaking and different things that they understand and that they think may be commonplace to even people in hospice. But it turns out that I had so much to learn. I was very humbled by those interactions that I was having. So I think one of the interesting things was uh, I began to want to have the staff at the hospices that I worked with begin to understand what it was to interact with people in funeral homes, because there's so much overlap. The overlap happens at the time that they're in hospice, and people are in hospice for an average of 40, 60, 80 days. And then the funeral home planning really was to begin here, but we noticed that it was planning here, and also sometimes at 2 a.m. at the time of death. And I really wanted to challenge my staff to become as well informed as possible about all the different ways that patients could potentially select a funeral home, and then what was actually going to happen in that sort of last moments, and who was going to call who, and sort of the very basic mechanics of it all.
I'm curious, how much did price come into the consideration when you were thinking in those terms? Because I think that's what a lot of funeral homes think of, sometimes maybe wrongfully so. When they think of hospice, they think, oh, they're just, if they're recommending or talking about any funeral home, they're just giving out information on the one with the lowest price.
Sure. So to be totally honest with you, most hospices and the people who work for the hospice are not particularly knowledgeable about pricing. So if you said direct cremation, nobody would really even A, understand what that was, and B, understand what the costs of that were. And we're talking about, there's 6,100 hospices in this country. And I worked for, several hospices that had really smart nurses, really smart chaplains, really smart social workers, but this was just a knowledge gap. So I would say mostly it came down to reach out to these different funeral homes that are in our area. We had to put the onus on the patient themselves and the patient's family to make those decisions. So as we were talking to families, I'm not sure that we were delivering pricing information. Did they express to us, the patients and the patients' families, that cost was an issue? Absolutely. But we were not really capable of, nor did we actually feel it was responsible to go into the pricing. We're not salespeople. Our goal was to make sure that that moment that the patient died and the family could be by their bedside, that transition happened. So we were very mechanically focused and less focused on sort of the whole industry and how we could better explain that to patients and their families. I think that is a knowledge gap that is on the hospice side, that I think funeral homes could do a better job, um, giving information in a way that could help drive business their way, or help us become better teachers to our patients and their families so that we could help to understand it. In some ways, it was just, here's a list and you guys have to kind of go figure it out on your own. But I certainly think we could, with some extra knowledge on the hospice side, certainly help to make those recommendations a little differently, not necessarily directing people to a specific funeral home, but maybe to a specific way that they could envision it. This discussion about death, and it goes so far upstream. Somebody might be in the ICU for 3 weeks. Nobody will have talked about end of life, and certainly not funeral planning. So we became the arbiter of that discussion for well over, and depending upon the hospice that I was a part of, well over 50% of the patients and their families is having that first early discussion about choosing, like, what's going to come at the actual time of death, and do you have plans for that?
What are some things that you see funeral homes do wrong when it comes to hospice? I mean, every funeral home knows it's important to try to make those connections, develop that relationship, but I suspect they're not always going about it in the right way.
Sure. So I'd like to also talk about what funeral homes might be doing right. So we're going to talk about both. I think one of the things that funeral homes do right is they do know who the local hospices are that are sort of driving, not driving business, but are often the source for some of their business. They do know who they are. One of the things I see hospices and funeral homes have a challenging relationship is as follows. The issue of death certificates is very confusing. It's challenging in many states. Many states have, and not all, but most states, I would say at this point, have an electronic death certificate portal where physicians go in and they sort of fill out some information about the cause of death and it gets transmitted. There's a huge administrative burden on both ends, right? The administrative burden is often on the end of the hospices because getting a patient input into a new portal requires data entry and sort of just, it's very mechanical. And then the physician then has to then separately go in. And then the funeral home then has the information they can run with it. I think one of the things is the relationship oftentimes between hospices and funeral homes becomes challenged by that one very simple document, because it requires people doing people work. And the funeral home may be very eager to get that information and have that, ready and waiting. And that's part of the customer service that they provide. And the hospice is challenged with taking care of people who are still alive and helping them to die well. So I think one of the things I think hospices and funeral homes need to do a better job is about collaborating and understanding the workflows that occur in their organizations to work together and not to see themselves on different sides of an argument, if you will. Different sides, like I need the death certificate, and the hospice is like, I got to get my doctor to sit down and do this. And So it is a challenge to make sure that we're all on the same wavelength. So I would say that's probably the biggest thing that I think um, we could also work on. I would also say that funeral homes are not as present in our understanding of the vendor relationships that we have. In hospice, there's lots of vendor relationships, the people who provide the durable medical equipment, the people who provide the medications, and that's all very well delineated. But how we interact with the vendors is really undefined and is very, very local. And certain funeral homes really want to make sure that the people who are having those conversations at the level of hospice, like I said, some hospices, it's well over 50% of patients have not yet made that decision. So how funeral homes can recognize that and understand that this is not all a pre-need driven, process. People come into hospice having not thought about it. And how can the funeral homes go back into the hospice, provide education, provide support? Because what happens at 2 a.m. if a patient dies can be very chaotic. So a lot of this is about last mile issues and about, mechanics. So yeah, I would say that to summarize, one of the things I think that hospices and funeral homes don't do right is make sure that they are working together, not in opposition to each other.
Wow, those are some great insights, Dr. Schiffman. We've only been chatting about 10 minutes, but I can tell our audience at Funeral IQ is going to glean so many insights from you during your talk. For those watching, there is still time to sign up for Funeral IQ, which again will be September 20th at the Live Casino and Hotel in Philadelphia, Pennsylvania. What a great venue. Plus, Funeral IQ is approved for 5 hours of continuing education by the Academy, as well as for CEUs by individual states such as Pennsylvania, New Jersey, Maryland, Ohio, Indiana, Tennessee, Massachusetts. The list goes on. Sign up at www.funeraliq.org while seats are still available, or just click on the events tab on funeralvision.com to learn more. Plus, as a bonus for those watching, I'm going to give you a promo code to enter at online checkout to save $100 on your ticket. If you enter promo code FIQ24 VIP 100, you'll save $100. Again, the promo code is FIQ24 VIP 100. Sign up at www.funeraliq.org or click on the events tab at funeralvision.com. Dr. Schiffman, any final thoughts before I let you go?
I guess I would just say that every hospice and every funeral home needs to strengthen their relationship, and I know that it will yield tremendous results for the families and give great peace to the patients as they're dying. I think we just need to strengthen those relationships, and I really look forward to the conference.
Well, I'm looking so forward to seeing you in person. Thanks so much, Dr. Schiffman.
You're welcome.